The patient was angry. Dr. Antoinette Rose, an internist at the Palo Alto Medical Foundation, could hear it in his email. The patient trusted her, he wrote, but he'd been suffering for months, and no one seemed to care. She immediately picked up the phone, but her call was sent to voicemail. The patient was a veterinarian in a large Northern California practice. He was always busy reviewing his chart. She was surprised to see that he'd been sick for nearly 3 months. It started with an infected tooth and swollen glands. 2 rounds of antibiotics hadn't helped. After 6 weeks of feeling ill, he called Rose's office. She was booked, she recalled, so he saw her physician assistant. The PA thought the lymph nodes were enlarged as a result of a dental infection. She sent him to the lab to check his white blood cell count. If he was still infected, the count would be high even after the antibiotics. It wasn't. She also ordered a test for mononucleosis. That could certainly cause swollen glands and fatigue. And she checked his thyroid level. Too little thyroid hormone can make you tired. Both results were normal. A reasonable workup, Rose thought at the time. She still thought so. Swollen glands. Shortly after seeing the PA, the patient had his tooth pulled. That got rid of the pain but not the tender glands. A few weeks later, he emailed Rose saying he felt worse. Some of the glands had gotten smaller, but not all. And he felt a tiny, tender lump behind his collarbone. He'd never had those glands swell up before. And now he was exhausted. His body ached as if he had worked out too hard, though he was too fatigued and sore to go to the gym. Rose was out of town, so she arranged for him to see her PA again. And again, the PA found nothing except the single node behind his clavicle. She checked his white blood cell count again. She tested him for HIV, though he was in a monogamous, long-term relationship with his partner. She also checked for tuberculosis. One form of TB, scrofula, shows up in the glands of the neck. All the tests came back normal. But because a lymph node was in an unusual place and because it was persistent, she referred him to an ear, nose and throat specialist to have the lump biopsied. No appointments available. Trying to get in to see an ENT was the last straw. No one had any openings for weeks. That's when he wrote the angry email. Really? He fumed. Was this the only way to find out why he, at age 44, felt like an old man, with aches and fevers and swollen glands? Now the spot behind the other clavicle was tender, and so were his underarms. For the past week, he'd been taking some antibiotics he got from a friend, just in case they helped. They did the NT. Rose replied immediately. She didn't usually see patients on Fridays, but could he see her then? She felt a little guilty. Once you develop a plan, patients will fall off your worry list as you wait to see results. And if something goes wrong with the plan, it's hard to know and put them back on the list. Until they complain. Feeling terrible then he came to the office. Rose thought the patient looked tired and thin. With him finally in front of her, she got the whole story. He'd felt off and on sick since the tooth. He'd get a little better, then worse. Now he was achy all the time. He'd gone through 2 bottles of ibuprofen. That helped, but why did he have to take anything? He always felt hot, though he didn't think he had a fever. He'd thrown up a couple of times and twice had sweat so bad he had to change the shirt he was sleeping in. On exam, his arms and hands were covered with scratches and scars, souvenirs from a practice devoted to reptiles, birds and what he called pocket pets, ferrets, rabbits and small rodents. On his thumb was a healing laceration, an injury from the talon of an irritable falcon. The spot where his tooth was removed looked well healed. She didn't find any enlarged lymph nodes in his neck. But she found one in the hollow behind his collarbone, and that was worrisome. Those glands would not react to an infected tooth. His underarms were tender, though again she couldn't feel any abnormal lumps. When she examined his stomach, however, she felt the tip of his spleen. This organ, basically a very large lymph gland, is on the upper left side of the abdomen and is mostly hidden by red band bowels. The only time you feel it is when it's enlarged. Dangerous possibilities. Rose quickly organized her thoughts. All these enlarged lymph nodes suggested some kind of infection. The infection in his tooth could have gone to his heart, quite rare in someone like him, with a normal heart, but potentially deadly. She would get a test to look for that kind of infection. Lymphomas, cancers of the lymph nodes, can cause these kinds of symptoms. That's why he was scheduled for a lymph node biopsy. As a vet, he was at risk of catching something from his patients. Cat scratch fever can cause enlarged lymph nodes, fatigue, fever and malaise. Tularemia, transmitted by rabbits, has the same kinds of symptoms, although it is often preceded by an ugly rash. He went to Hawaii earlier that year and swam, which might have put him at risk for leptospirosis, a common infection among wild animals transmitted through contaminated water. The patient himself brought up the possibility of Lyme disease, unlikely in Northern California, but possible. She also wanted to check again for the most ordinary causes of fatigue, malaise and enlarged lymph nodes, mono. He'd had a negative rapid mono test, which was pretty accurate. But no test is perfect. And that test looked only for the most common cause of mono. There are several others. Finally, she arranged for him to be sent to an infectious disease doctor to make sure she hadn't missed anything. And he was already scheduled to see an ear, nose and throat doctor to get a needle biopsy of his enlarged gland. Unusual illness. Rose was grateful for another opinion because the first batch of tests didn't show much. The biopsy was normal. It wasn't Lyme or tularemia. It wasn't cat scratch fever. He hadn't picked up leptospirosis in Hawaii. The only positive results were for the two types of viral mononucleosis. Most cases of mono, up to 90%, are caused by the Epstein-Barr virus. His blood tests showed that he'd had that, but not recently. Rose had looked for another type of mono, caused by an Epstein-Barr cousin, called cytomegalovirus, or CMV. And that test suggested that he was infected and recently. Cytomegalovirus is a virus in the herpes family. It's common and gets more common with age. Just over 1/3 of children under 12 have had it, but 9 of 10 adults over 80 have. But the virus rarely causes mono, or any other symptoms. Rose was dubious. Could all these months of aches and pains, night sweats, vomiting and diarrhea really be from mono? She called the infectious disease consultant and shared the results. She was also surprised. She ran the test again. Still positive? He could have had so many exotic infections. But it looked as if what he had was mono. Rose called her patient to let him know what he had. "You are going to get better," she assured him, "probably very soon." But it was not soon. When it was verging on 6 months, she referred him once more to have a lymph node biopsied. But by the time that appointment came, the node was no longer enlarged, and the patient was starting to feel better. Doctors often don't take diseases like mono very seriously. Self-limited, we call them. What that means is there's nothing we can do but wait and let the body recover, the task much easier for the doctor than the patient.